So my name is Dr. Mark Lewis. I am a gastrointestinal oncologist, and specifically I work at Intermountain Health, which is an 8-state system based in Salt Lake that covers essentially this entire region up to and including Idaho. So it's a particular thrill to be here in Boise.
Yeah.
And this is my first time being a conference chair or co-chair.
Yeah.
And it was so interesting because actually Dr. Shah, with all of his networking, was teaching me kind of the landscape.
Yeah.
And I don't pretend to understand how oncology is practiced in Idaho, but he has such a deep history and understanding of this area that it was actually kind of a two-way street. He sort of asked me to help recruit sort of local and regional experts, and I was happy to do that. But on the flip side, he taught me, and your organization taught me a lot about how things work here. And it's interesting, it's almost like we're trying to universalize care, but it's like that whole thing, you know, think globally, act locally, where you still have to understand how treatment is delivered and you know what specialists are available in any given area. So again, it's kind of a beautiful quid pro quo. Yeah. So Dr. Vaklavas and I are colleagues in the sense that he works at the Huntsman Cancer Institute, which of course is a famous NCI designated cancer center, and at Intermountain, we're in this weird spot where we're not private practice, we're not purely academic, we occupy what we like to call a community academic hybrid. So I know him both by reputation and actually from planning these kind of educational events before. So in Utah, we have something called the Society of Utah Medical Oncology, or SUMO, and we actually put on these update meetings every year just in our state. And the theme is the same, which is that there's so much to know that I also would say we have a breadth and a depth issue where most oncology in the country, again, is being practiced by people who have to, quote unquote, see everything. And yet, it's so hard to keep up with all the different tumor types. And so when you actually take a moment and take a deep breath, devote, say, a weekend to this lifelong learning that we're going through, then I think you can have the convergence of generalists and subspecialists in a way that again benefits both groups. For years now, I've known and been lucky enough to work with Dr. Shah in the Binaytara Foundation. One of the things I admire so much about him is his extremely authentic focus on correcting healthcare disparity.
Yeah.
And there's a number of ways that we can measure that, of course. Yes, it still makes sense to have these centers. But rather than thinking about those centers as magnets that draw the patients to them, could we flip it the other way around? And weirdly, COVID, as awful as it was, sort of proved to us that yes, we can. And necessity being the mother of invention, you saw very quickly a lot of that magnet model actually flip into a hub and spoke model where yes, we still have these centers of excellence, if you want to call them that, but they were distributing their knowledge and in a lot of ways distributing their care across these vast geographies. So one of the things I love about Dr. Shah and the foundation is thinking about geography. Of course, so much of his work is in Nepal.
Yeah, huge focus. Yeah.
Of course, and thinking about the low and middle income countries. But even here in the United States, I wrote a piece a couple years ago called The Disunited State of Cancer Care in America. And what I really meant was it kind of becomes the haves and the have-nots for literally the majority of Americans. And we also know that 80% roughly of cancer care in this country is delivered by general oncologists. That's not a bad thing. It just means that they are not subspecialized. How long does it take for that to actually filter down into what we might call the community or real world practice? And the answer is it takes years. And Dr. Shah acknowledged that this morning in his opening comments. So I think what we're actually trying to do is close both of these gaps. One of them is in space or distance, and the other is in time, so that it shouldn't matter, honestly, where you live. Your oncologist should be up to date, and honestly what we should be trying to do is bring care to the patients and not the other way around. So that's why I'm here, and that's kind of a really interesting convergence of what I do in my day job at an 8-state healthcare system and what Dr. Shah and the foundation are doing. I guess the way I put it is you build a trust relationship with your patient. So you know, if you were diagnosed with cancer and I'm prescribing chemo, you have to trust me in 2 levels. You have to trust me that the diagnosis is right, you have to trust me the treatment's right. And that's a very, very close bond that forms, you might imagine. But there does come a point in my practice too where I realize, you know what, this patient needs a clinical trial that I just don't have. Or they need, say, proton beam radiation that I don't have. And knowing when to refer and to whom to refer, that's crucial. And that also is a part of these conferences, is making these networks, not just abstract, but real and organic. And again, it's ultimately for the benefit of the patients.